The information shared on the Sky Women's Health podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding your medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Reliance on any information provided by Sky Women's Health, Dr. Carolyn Moyers, or any guests featured on the podcast is solely at your own risk. You're listening to Sky Women's Health Podcast, your evidence-based resource for women's health and wellness, exploring the holistic principles of osteopathy, integrating mind, body, and spirit, designed to empower you as your own healthcare advocate and help you live your best life. I'm your host, board-certified OBGYN, Dr. Carolyn Moyers. Welcome back to Sky Women's Health Podcast. I'm so excited that you're with me today. We are talking about a very important topic, and I have some very important guests with me, Dr. Meredith McClure and Dr. Ashley Fuller of Labia Logic. If you haven't tuned into their podcast yet, just pause and go follow the show. It will be a great learn because most of us did not learn anything about the labia, let's be honest. Welcome, ladies.
Thanks for having us.
Yeah, we're excited to be here. Thank you.
Absolutely. Well, I'm excited because we're talking about vaginal foreign bodies today. And we're gynecologists. We see this all the time. It happens to more people than you think. And so I want us to remove the shame and help women know when to seek care.
Yes.
Mm-hmm.
Yeah. I love it. Yep. That's things happen.
Yeah, it sure does
happen. Yes. Yeah. And I don't know if you guys are armcharies or if you'll listen to Armchair Anonymous, but they always have on Fridays, these prompts and people will call in and they always do rectal foreign bodies. And I was like, why didn't we ever do vaginal foreign bodies?
Yeah.
But I think only the gynecologists, I think, can talk about this and it not, maybe be cringe.
Yeah. We've all seen it.
Yes, definitely.
And there's more to come in our lives. So
that's right. More to come. So let's talk about what counts as a vaginal foreign body.
I mean, anything that shouldn't be there, right?
Right. Yeah. Tampons, menstrual cups, condom fragments.
Condoms.
Mm-hmm.
The cap from yeast infection medication. I've seen that, and it took a long time to figure out what was this that we found.
Yeah.
Yep. Tampons I think is so far the most common one that we see, or at least I've seen.
I've seen M&Ms.
So in PD and pediatrics?
No.
No? Okay. Yeah.
That would have been sometimes in the emergency room. People come in and they need some help, and we got to help them.
Sure. Yeah. Yeah. Most of these are accidental and temporary, not really intentional. And a lot of times there's a lot of shame or uncertainty, right? And I will tell you the oddest thing that I've found is a vaginal foreign body. And we also did not know what it was. And it was in residency in the ER, somebody comes in having pain and discomfort and do an exam, and there's certainly something there, but it's really hard to tell. We got imaging and ultimately had to go to the operating room, and it was a perfume bottle cap that was kind of rounded. You remember that Baby So Soft perfume from when we were kids? And that's what it was. It was a Baby So Soft cap. And it had been there so long because of the fear and uncertainty and, it was a younger patient, but it had created a little fibrous edge around the sharp, edge of the perfume cap. And we had to go surgically and cut the vaginal tissue to release the adhesion and get it free, or the scarring, I should say, and free it.
Yeah. Just goes to show you the vagina didn't want it in there anyway. It was trying to wall it off and protect itself. It's just the human body is so amazing that it can do that.
Yeah, absolutely. Okay, so common scenarios. We talked about a forgotten tampon during heavy periods, right? Or 2 tampons maybe get inserted accidentally, or maybe postpartum exhaustion or perimenopause brain fog or travel and busy schedules and, life happens. This is human.
Yeah. I think there is a lot of shame around it. And I always try to tell patients, like, this could happen to anybody. I mean, probably everybody's had that moment, like, did I change my tampon? How long has this one been in here? Or, oh, well,
Yeah.
how do I have two? Like, it happens.
We've all been there.
We've all been there. I just try to really get rid of the stigma and remind people, like, well, I'm glad we're figuring this out. Like, now we know why you've been having this discharge or this odor. Like, this is a great there's a nice, like, concrete reason that you had this, and now we've solved the problem rather than worrying about some bigger thing like a cancer or like a big infection. It's like, we just have this thing we have to remove and things are going to get better for you.
Right. Yeah. So let's talk about those common symptoms.
Vaginal discharge.
Yeah. Discharge, odor.
Yes.
Yep.
Vaginal irritation, bleeding, irregular bleeding or spotting.
Yep. Yeah. Usually people tell me, like, there's kind of this, like, brownish, if it's tampons, brownish, icky discharge that kind of can come and go, sometimes worse after sex, and has a lot of odor to it.
So we need to talk about when we need to go see the gynecologist. First of all, I want to kind of demystify the visit, right? If something is amiss, we just need to do a quick pelvic exam. It's usually, if there's something there, it's usually easy enough for us to remove and you get immediate relief from the odor and the discharge. Sometimes there may be an infection and we need to treat it, right? But like, this is a no judgment zone. Like, this is just routine part of gynecology.
Yep.
It's like going to the ENT and you're getting something out of your ear.
Like your kid put something up their nose. Like, you got to go get it out.
Yeah. I'm kind of curious in PD gynecology if they see more like Legos in the vagina,
Toilet paper. Toilet paper is a big one for pediatrics. If they have irritation or UTI type symptoms. So, that is part of the thing though. They put the knees to the chest and have them cough and you can find toilet paper there.
Yeah. So this is a common question that I get from patients. Well, if I had one, wouldn't I see it? Like if I bear down and I had a mirror, wouldn't I see it? And you would be surprised how high those tampons can be hiding.
Yeah. You kind of lodge like posterior to the cervix. And I think they kind of just like get stuck there so that it's really hard. I think it'd be very hard to feel with your finger or, I mean, even sometimes in the office, you're like, wait, do I see something? Even with a speculum in, they kind of hide underneath that cervix. Sometimes it can be hard to see.
Yeah. So we've established we want to come in if we're having persistent odor, discharge that doesn't resolve, pelvic discomfort, or concern that maybe something's left behind and we can't get it.
Like even a condom or things like that will happen. And people like, oh my gosh, I don't know where it is.
Yeah. So what do you guys think, in terms of like when someone's getting antibiotics or, because sometimes just removing it is step one, right? A lot of times antibiotics are not needed. So when do you kind of draw the line or feel like something more is necessary? And do we feel that partners are at risk when they're having intercourse with patients who have a retained product?
These are good questions. Generally I remove it and, if they haven't had fever, or, some other signs of more of a systemic infection, I generally don't give antibiotics. Let them know that like the vagina is a self-cleaning organ. It usually will help get rid of once this foreign body is gone, the tampon or whatever it is it will kind of clean itself out. But I warn them if like they have worsening symptoms, even after it's out, then we should treat them. But generally I think this is like a lot of the symptoms women have are more from the vagina trying to get rid of it or reacting to it rather than actual infection. And so I don't think you need to treat the partner. I've never done that. I mean, if they have bacterial vaginosis, but I usually let them see how things kind of get back into a norm, like give them a couple of days and see how things are. And if then things are not improving, that's when I would treat them.
Yeah. I was kind of shocked this year as I realized that this is my 20th year as an OBGYN. And just recently did I have a male partner who developed a UTI from, we would assume, right, from this. So that I thought was really interesting because I was like, not typically. I'm really not worried about the male partner. I haven't had that happen. So that was kind of an unusual presentation. So I guess also, if for your partner things don't seem right, we need to also get checked out.
Yeah. And having that open dialogue with your partner, I think that's always, it's okay. Like,
yeah,
you can be honest.
It's okay.
Lay it out
Can
there.
you imagine
totally
if a man
fine.
had to keep up with sanitary products and tampons or period cups? Like, come on.
I don't know if any men in your life get man flu, but there's a man in my life who gets man flu, and I can't imagine if there was like man periods that happened every month.
Oh, like the world would stop.
The world would literally stop.
Yeah, and we'd be picking up the pieces like always.
Like every month.
Yes.
Oh my gosh.
So, and that's not even talking about the actual sanitary products that we're actually speaking of. So that's like a whole other level of it.
Yeah.
Right. Right.
Yeah. God only knows how we'd magnify the menstrual cramp and the man.
I would just say that like vaginal odor, there are different odors that can mean different things. And if you feel like your odor is off, I don't always think it's a reason to get checked out. And if it's just something that kind of comes and goes, you can kind of keep an eye on it. But if you're feeling like, oh, it smells like something died in my vagina, or like I've had people use those terms, that's a sign that you should get checked out, because it could be a retained product. It could be something else going on too. So we definitely want to make sure that we're, like if you're having these symptoms, that you go get checked out so that we're not missing something more serious. A retained tampon can actually cause something like toxic shock syndrome.
Yes.
When we trained, I feel like I learned a lot about that. It was even as a girl going through puberty and learning to use tampons, it was like this really scary thing. I don't see it very much. But
I don't either.
Right? But it's something I always think about, especially with retained tampons. People always ask me, am I going to get toxic shock syndrome?
Yeah.
And I have not seen a case of toxic shock syndrome in my career. So
I've seen it once.
It's pretty rare. Okay.
I've seen it once. It was not from a tampon. It was actually from a menstrual cup. And then she had that removed right before a hysteroscopy procedure where camera was put in the uterus with water, and it took bacteria from the vagina and the menstrual cup, and it put it into her abdomen. And she was septic. And we all were scratching our heads like, what is that going on here? And then figured that out. So from that moment on, it was always like, take your menstrual cup out and don't use one if you're having a gynecology surgery the week before, we were super vigilant with that because we did not want to see that ever again. She did fine, but she was in the hospital for like 2 weeks.
Wow.
Mm-hmm.
Yeah. I've also seen in the postpartum period where they're like, the discharge just doesn't seem right, and found sponges that were left, just little pores for bleeding that were left. So yeah, if something doesn't seem right, please, like there's so many different things that could be going on, but that persistent foul odor and like brown discharge is what I commonly hear. Or, I had a lady come in with wanting to have a hysterectomy because she was like, I am just over this. Like, why am I bleeding all the time? And we failed to retain menstrual cup.
Oh, wow.
Yeah.
Cured. Like that's what that's an easy fix. It's not always that easy.
Right. And we don't
have
recovery
instant
time.
gratification. Yes. You can walk out of there with your head high. I did it. I'm cured.
That's right. Although I think when she left, she was like, how did that happen? Oh my God, I've got to find a new gynecologist. Like,
I feel like a lot of people do, don't you though?
Yeah.
Like a lot of people, I feel like, and I found retained objects, I will never see them again. And we don't care. We don't care. We see a lot of people, we probably won't even remember that happened.
Yeah.
It's just another day in our life.
Right. It's just another day as the gynecologist.
Yeah, exactly.
So I think it's it's important to think about, like, when people are having all this kind of weird bleeding in perimenopause or postmenopausal bleeding, especially in perimenopause, my thoughts are always about hormone balance and where I'm always thinking about hormones. And sometimes it's actually good to remind ourselves, like, oh, it actually is really important to do a good exam and make sure there's not something like this that could be so much actually probably easier to manage than perimenopause in general. Right? Like it's not about hormone imbalance that's causing this bleeding. It's like there's a retained tampon or a retained cup or something that, or even a cervical polyp or something that, but, reminding us that, like, an exam is always a really important part of medicine, which I feel like for a lot of specialties, a lot of fields lately, like, the exam is not as common from clinicians as it used to be.
It's kind of a lost art. I love to ask people when they go to the emergency room, I'm like, did anyone even touch you?
Right.
Because they're like, no, they just sent me right to a CAT scan and put a needle in my arm. Like, yep, that's about, like, you go for pelvic pain, like, you should have somebody evaluate your pelvis and your vagina and your vulva. Like,
yeah. Can we also, though, just kind of this public service announcement here, ladies, that in the ER, you're not getting a pap smear. I think that's a misconception. A lot of times they're like, oh, I will less pap. Oh, well, in the ER. And they don't do preventative tests in the ER. You would not have gotten a pap smear in the ER. You may have had a pelvic exam in the ER. Not a pap smear.
Right.
Which is our cervical cancer screening.
Yes.
And hopefully they left nothing behind if they did do an exam.
Right.
Yeah. Yes.
I think one of my most surprising findings in the ER was a vaginal cuff dehiscence. So somebody who had had a hysterectomy who had, but it had been 8 weeks and she had persistent pain and a watery discharge, right? It could have been anything. And I went in and sure enough, there's bowel coming out of her vaginal cuff that's wide open. So a pelvic exam is so incredibly important.
Yes.
Absolutely.
I wonder if we have any tips and tricks as gynecologists to help people avoid retained foreign bodies.
That's a tough one. Because I've even been in situations where I'm scratching my head, like, did I use a tampon last night? Did I not? Of course, we can kind of know what we're looking for when, on ourselves more so than other people, but that's a tough one. Because even, like, you could say, like, oh, look at your trash can, but you might have been at work or, out to dinner and, like, you can't really do that. So,
yeah.
How about, I'll say get an IUD so you don't have periods. I always say, like,
that's a good PSA.
Yeah, like if I was, or go on a continuous, like, hormonal contraception that can help you not have periods. Because I don't know, in my perimenopause, if I had to have a heavy, long, painful period every month, I always say that would be like the straw that breaks the camel's back for me. Like, I know women do it all the time. But it's a lot, and I think that not everyone who has an IUD has amenorrhea or a lack of period, but I definitely, as part of the PSA, I would say, if your period's bothering you, talk to your gynecologist because there's ways to make it easier. Periods I just think they're annoying, and it's just one more thing we got to deal with. So I definitely think it's something to consider.
Yeah, if we're not trying to get pregnant and we're in perimenopause, or we don't need it. So I love that. I love continuous birth control if they're, earlier in that process, or a progesterone only birth control in combination with an estradiol to help relieve the symptoms, because it's going to control the bleeding really well. Or a levonorgestrel IUD like Mirena or Liletta that has an indication for heavy menstrual bleeding for 5 years, which is awesome. You could still use your estradiol patch, but you have complete control over your bleeding, and we don't have to worry about pregnancy either. So that's really, really nice. Yeah. Some of my patients who have had retained products were like, well, that's it. I mean, tampons and menstrual cups are dead to me. It will be pads or period peonies for the rest of my life.
Yes. But it is nice to have more options than just, a pad or tampon, It's nice to have the period underwear as an option too.
I know. It's genius. Especially for our kids. I'm like, God, you got it so good. We did not have it that well. It was here's some KY and a tampon. Best wishes is what I got. So
Or the big crinkly pads that you had to, try to sneak into the bathroom at school. Yeah, it's awful.
Your purse.
Yeah.
Your Liz Claiborne purse. Am I dating myself?
Oh, yeah.
And your Keds tennis shoes.
Yes.
All right, ladies. I want to just make sure that we assure patients that your gynecologist has truly seen it all. And if something feels off, just get checked out. It's just make the call. We are happy to help you, and it is not going to phase us in our day-to-day work. It would be the first time or the last time that we've seen it.
Truth.
Absolutely. If you need help, come in. We are here to help you.
Yes. Absolutely. Yes. Until next week, be well. Thanks for listening. This episode is sponsored by Sky Women's Health. If you love this episode, follow the show so you never miss one. Share it with the women in your life and help more people discover it. Let's make it binge-worthy.